Hey friends, welcome back to the channel. It's Dr. Chan here. In this episode, I'm going to talk about how to decide between ureteroscopy and extracorporeal shockwave lithotripsy for kidney stones. If you're watching this video, you probably have kidney stones and it's probably so big that your surgeon or urologist does not think it is going to pass. Now, there's two main options for stones that are a reasonable size. One is extracorporeal shockwave lithotripsy, where a machine is brought in which produces these shock waves that penetrate the skin and break up the stone, and then you pass the stones in small fragments. The alternative is ureteroscopy, which is where a small camera goes up your urethra, where you urinate out of, into your bladder, and then all the way up into your ureter to get access to the stone. Now, both of these are outpatient procedures. So what I'm going to focus on in this video is kind of walk through what I think about when I'm trying to decide whether to recommend doing ureteroscopy or shockwave lithotripsy for a patient with a kidney stone. So some of this data comes from this recent article. It was taking a look at all these different articles that have been published before, comparing ureteroscopy versus shockwave lithotripsy and looking at different outcomes. Now, there's three main things that I want to kind of focus on. Number one, what's the effectiveness? Namely, what is the stone-free rate afterwards? Number two, the amount of discomfort or pain that a patient is in afterwards. And then finally, number three, which one has complications associated with it. Now, these are specifically looking at stones that are in the upper part of the ureter. So the big pro of the shockwave lithotripsy is that it is a truly minimally invasive procedure. All the shock waves are generated and penetrate through the skin. Nothing goes inside your body. That being said, one of the downsides is, depending on how hard the stone is, the stone may turn into dust and pieces of sand, or it may just fracture into smaller pieces of stones, but they may still be fairly sizable when you pass them. Compared to ureteroscopy, where we can go in with a small laser right up to the stone and blast it into small pieces, the stone-free rate for the shockwave lithotripsy is a little bit lower, and there's a chance that an additional procedure may be required to fully take care of the stone. So that's a con of the shockwave lithotripsy. One of the pros that we discussed of ureteroscopy is that it is more effective, but this comes at a cost. Because there is this camera that's going up your urethra, up your bladder, and into the ureter, this is more painful. Usually what I counsel my patients on is that the pain associated with ureteroscopy is like pretty bad for about 24 hours. There's a strong sense of urgency and feeling like you need to go to the bathroom, maybe when you don't actually have that much urine in your bladder. Also, because there's a stent, usually a ureteral stent that's involved, urine shoots up backwards into your kidney and causes it to be pretty uncomfortable every time you need to pee. Also, because something is actually going inside your body, the complication rate of possible things that could go wrong with doing this procedure are a little bit higher. And these complications are possibly causing a stricture or scarring of the ureter, ureteral avulsion of the ureter. This is how we decide between doing extracorporeal shockwave lithotripsy versus ureteroscopy.